Hello, I'm Mabel Jong, and we're winding down on day one of the World Healthcare Congress 2015, and I'm very pleased to have Dr. Robert Grossman here with me in the studio, Chief Medical Officer of Transcend, a Humana population health management company. That's a mouthful, Dr. Grossman. How are you doing?
I'm doing great, thanks.
Well, tell me more about Transcend.
So Transcend is a company that is new. It came from Humana. Humana designed an MSO to partner with primary care physicians to provide them with resources, data, and to help align incentives to partner with the primary care physicians to improve the care that they can deliver to their patients.
Okay, so it's a data-driven company for the most part?
No,
okay.
Data is one component.
Okay.
I think equally important are we provide resources such as care navigators to extend the resources that a primary care physician many times does not have, to do some of the follow-up, to better coordinate care, to call members and get them back in for appointments to close their quality gaps, to make sure that they're seen within several days of their discharge from a hospital. So it's resources, it's data, it's incentives, it's financial incentives to make sure that we're aligned, that physicians have a reason to be engaged, physicians have a reason to pay attention.
Okay, describe to me what you mean by the incentives. What is getting physicians' attention these days?
Sure, so it's kind of a combination, a fairly typical pay for quality program, but more importantly, there's an opportunity to receive shared surpluses. So to the extent that physicians can provide care more efficiently and eliminate needless waste, there's an opportunity to get a fairly good return of portion of the shared surplus.
Okay. What are you finding in your work in this area right now that would be helpful for other people to know? It sounds like you're talking to a lot of physicians, you're trying to figure out ways to get more patient-centered care programs online. What is the most compelling thing you've learned?
Well, I think that as I talk to doctors, they almost uniformly like this. I think they almost uniformly say, that's a better idea, a better way to take care of patients, to do population health management, to not only focus on, whatever acute problem the patient's presenting with that day, but to really think about who are the patients in their panel who aren't there. Who are the ones who are high risk? What can they do to take better care of those patients so they don't just show up in the ER? So I think the physicians almost uniformly think that's a much better way to deliver care. I think they appreciate that, we have a way to help them do that with resources and with incentives that pays for their time, because it takes time to do that.
Okay. What is the message they're leaving attendees at this conference with?
The message is that value-based reimbursement provides real benefits for the patients who get more attentive, focused care, and for the physicians who can spend more time with their patients, can be reimbursed for doing that, and can feel better to taking more comprehensive care of their entire population.
Okay. And anything else we should know about Transcend and some of the work that's going to be coming up in the future?
Just, it's a startup company. It's grown very rapidly. We have about 65,000 members who are under arrangements with the primary care physicians, and we'll be doubling that number. We expect to double that number each year for the next several years.
Okay. Dr. Grossman, thank you so much for your time today.
Well, thank you very much.
I appreciate it. And I'm Mabel Jong. Thanks for watching.